doctor and seeing what further treatment can be offered in that kind of scenario.
And there's a website in the background here of the IPMA where you can call and get a referral to 2 or 3 podiatrists near your area. The website's ipma.net, and there's also an 800 number, 869-3338. Thanks for calling.
Thank you.
So I don't think we finished bunions quite completely yet before we jumped ahead to hammer toe. So why don't we just jump back to finish up our talk about bunions?
So as we said before, there are many different types of surgery available for bunions. It's a fairly long haul in terms of getting over the surgery. It takes about 6 weeks, sometimes closer to 8 weeks. It depends on what kind of surgery is actually performed. Once again, this is surgery that can be done on an outpatient basis, and patients, depending on the type of surgery that is done, can walk in a special surgical shoe. That's not always possible. Sometimes the surgeon may choose to do a certain type of procedure whereby the patient has to be in a cast or can't be walking for several weeks after the surgery. That's something that the patient and the individual surgeon can obviously talk about prior to surgery.
Sure.
As with most foot surgeries, careful planning is very much a part of a successful outcome, and so patients do need to obviously factor in what their work schedule is like and what their daily life is like in terms of how active they are, because this does sometimes mean patients can't be walking for several weeks afterwards.
Do patients that suffer bunions, even after surgery, do they find, or do you find over the course of time, over a large number of patients, that a significant percentage of them have another bunion on the other foot? Or a redo, for instance?
Redos are much less common, but very often patients do present with bunions on both feet. Sometimes the patients will ask if the surgery can be done on both feet at the same time, and for some patients that's the right thing to do, and for some patients it isn't, and the surgeon will obviously counsel them in this, and may opt to do the surgery at different times. It's certainly easier for the patient in many ways to have one good foot, as it were, to ambulate on or walk on, while the foot that's had the surgery is healing.
How would you advise someone to, if they had to choose between doing one at a time or both, how would you do that?
Well,
what kinds of issues go into making up that decision?
The issues that go into that are, first of all, once again, how active the patient is, whether they have help at home, which is certainly a big factor to think about, whether they have stairs that they may have to climb to get into their home. Those are probably the major issues to consider. And then there is the issue, of course, having to go through the surgery twice. Some patients want to get it all over and done with in one setting, and that's not an unreasonable thing to think about. But some patients are quite happy to go through surgery 2 times. But many patients do present with this condition on both feet, and so it is very often the case where even if one foot is done first, the patient will typically go ahead and have the second surgery performed at some later stage.
Right. Great. So we were going to segue into hammer toes, and our caller sort of made that bridge for us. So why don't we go back to that and talk. Hold up your model again, if you could, and show us where the most common form of hammer toe actually occurs.
Hammer toes typically we find will affect what we refer to as the lesser toes, which would be the second, third, fourth and fifth toes. And usually this results in if we can turn the foot this way, this results in the toe typically bending up and assuming a shape something like this. And typically what will bring the patient in is actually the complaint of a painful callus or a corn, an area of hard skin, either sitting on the top of the joint or on the end of the toe. Of course, this can make walking extremely painful and wearing shoes painful, and the caller who'd called in before asked if this is something that one is perhaps born with or has a tendency for a risk in terms of family history. The answer is that sometimes there is a family history, and sometimes it's just the foot has poor mechanical function, which allows the hammer toe to actually develop. Shoe gear can certainly aggravate these type of problems, and
isn't that bone bumping up against the inside of the foot?
Right. When the patient's walking, very often there's a tight tendon which is pulling the toe up and making it deform and bend. And so again, we would always certainly try to use non-surgical approaches initially, such as changing shoe gear. Sometimes physical therapy to improve muscle function can help, but really in the end, if it becomes what we would call a fixed or a rigid deformity where the toe simply doesn't bend and it's continually getting pressure in the shoe, then we would look at surgery to basically straighten the toe out. Now, as with bunion surgery, there are many different types of surgery for this. The simplest approach would usually involve cutting the actual tendons, one or two on the top of the foot, which would take tension off the toe and allow it to sit down. But sometimes that isn't enough, and we actually have to do work on the bone to pull or take part of the joint out and allow the toe to sit down straight. And this is when we'll typically have to put a pin through the end of the toe, and that will hold the toe straight while it heals, which usually takes about 4 to 6 weeks. And as we said before, the patient can walk in a special surgical shoe during that time, and very often patients have more than one toe that needs to be worked on. It can very often be 2 or 3 toes on each foot. So this is a very common type of surgery. The outcome is often very good, and patients do very well. So it's a surgery that podiatric surgeons do actually do fairly
a little less severe than a bunionectomy, for instance.
It still involves surgery, and as with all surgeries, there are risks and things that we have to consider, but the healing time is probably a little quicker. Very often, of course, patients come in with bunions and hammer toes, and these are conditions which need to be treated at the same time. And so ultimately it's the length of time from healing from the actual bunion that typically dictates how long the overall healing time will in fact be.
So we spent the first half of the show talking about the forefoot. We can say that quickly. And so we're going to move back towards the heel and talk about some of the two of the more common heel area related surgeries that you do for plantar fasciitis and heel spurs. But before we do that, we're going to take this caller. Go ahead, you're on Feet Forward. Can we help you?
Yes, gentlemen. I'm the caller that asked you earlier about the hammer toe. Another quick question. I'm not too much of a gym shoe wearer. You know, you see a lot of people wearing gym shoes now, but I'm a leather shoe wearer. So is it all right to wear leather shoes a lot? Because, you know, a lot of people say as long as they're not pointed and they square and they open, you know, it's much better than wearing a pointed shoe. And, you know, the styles now is a little bit more open anyway. But what is your outtake on the gym shoes? Should you buy, like, walking shoes? Or I particularly don't like gym shoes, period. But if you got to buy gym shoes, which one should you buy?
Sure. Well, I think to answer the first part of the question about leather shoes, leather is certainly a very healthy substance to be in contact with the foot. It's obviously a natural fiber. It helps to absorb sweat, which is certainly something which makes it less likely for bacteria and fungi, which can cause problems on the skin. So a leather upper to the shoe and perhaps a leather sole is certainly a healthier choice perhaps to wear on the foot. Gym shoes are very popular, partly because they're fashionable, of course, and they come in different styles and different colors, which people like. They're also, for us, a very healthy foot shape. They have a rounded toe box, the area where the toes sit. They're really what we would consider a foot-shaped shoe. Of course, pointed shoes are not, and that's where patients can sometimes develop problems with bunions and hammer toes and the things that we've been talking about thus far. So